at the end of the day, the idea is to promote primary care reform. How can we make the clinical life, for lack of a better term, more attractive for the clinicians, particularly in family practice. The model that we built for the South Calgary Primary Care Network is we built it on the mantra that we are EMR agnostic. At the moment, we have one vendor that's running their EMR in our environment, and that's getting a lot of positive traction. But we also encourage other EMRs to come in and install their EMR, and so we can start forming a partnership. We are grateful for the partnership that we've established with CIBO Systems, and not only helping us get to where we are right now, but as well helping us go to the next level. Through a partnership with CIBO and Sun Microsystems, we have achieved a simple and effective solution through the use of Sunray technology for our clinicians. We believe it's the first time it's been implemented in Canada in a primary care setting, in a community setting, private physicians' offices. And now they're starting to integrate. And in essence, that's what Primary Care Network is all about. We're connecting the community by means of access, simple access. And it becomes almost transparent to the clinicians and to the healthcare consumers.
So we started with the Sunray in July of this year, and it's been a big time saver. It's great. You can come into the office, put your card in, easy access to everything that we need to. The program that we're using is great, the Wolf program. It's very convenient, it's easy access, and cuts my work down considerably. That I can use my card, I can have a patient in my room, I can leave that room, take my card with me, and I know that the computer's secure, that there will be no other access to it. I can also leave and go to another computer and plug in my card and carry on right from where I left off.
We're a small clinic, and so when we initially went electronic, we had to have a number of different PCs for the different people working here. We carried laptops, or tablets actually, into the rooms, which required quite a bit of cost to set up, and we had our own server in the practice when we first started. The challenge is, a lot of it is security. You have to worry about fire, you have to worry about flood. When you have your own server on property, those are issues that have to be dealt with. As our hardware aged and it was time to replace, we were approached by our primary care network here in South Calgary to look at Sunray systems and having an external server and to manage our office flow better and to reduce some of the security issues that we had to deal with having the server on property. We don't have to worry ourselves about the backup. The backup is being taken care of for us, the server off-site. Regarding the computers themselves, with the Sunray system, I plug in a card and I come up. I'm not having to constantly log on to the system. It's very secure. When the card's removed from the Sunray, the screen goes blank. And so that has, for me, the big issue was security, and that with the patients. We have the full hardware backup, but there's not as much that can go wrong. So because that's how I envision it, and this is maybe very simplistic, but I look at the Sunray as being a TV screen, and it's my little card that patches me into my data. So it's like I don't have a lot of moving parts that can go wrong. So prior to the PCN involvement in our IT, we really were on our own out in the woods. And what the PCN did to us was not only provide IT support, because we're not IT specialists, but they also brought us solutions, both hardware and software solutions, that they brought to us as a group. They brought a large number of clinics together to provide these solutions so that we weren't isolated, and it's been a wonderful partnership.
Before the Sunrays, when I had a PC and I had to update things, it was always a question of whether the virus or software would interfere with everything that the programs were running. So now I know that SIBO will look after the server issues and update things for me, and I have the Sunray, which is totally secure. No information can be removed from it. As far as USB capability goes, nothing can be removed. It's secure that way. We implemented 10 Sunrays within the clinic as a trial basis for them to get comfortable with the screens and how the cards would work. Everybody was issued with a card so that the limited few Sunrays we had within the clinic, everybody could have a go. They'd all swap and use different positions, so they could use the Sunray just on a rolling basis for their evening walk-ins, for example. And then they got more comfortable with it, so we brought the rest of the Sunrays in throughout the clinic in all of the administration positions and within the exam rooms. And then the doctors realized that they couldn't function with a PC on their desk and a Sunray in the clinic, because every time they logged on it was just one session being allowed. They were kicked off on their computer, so they decided that they would get one on their desk also for ease and smooth transition of workflow. So as it went, there was one or two that asked for Sunrays to be ordered. They were installed. The doctor on the desk beside them saw how great this was, and they were asking me for Sunrays. So by the end of the week, I'd had 2 or 3 orders per day, and desperately trying to keep up with them to get the Sunrays in, as they were so pleased with them. They wanted them yesterday. So.
Well, so far, I can see huge advantages with the using the Sun system, the Sunray terminals, just mainly because ease of access to patient chart, being able to log on to any computer wherever you go, and you come up exactly where you left off on the system. Not having to log into multiple computers. You log in once and you unlog once throughout the day, and that's a huge time saver. Their labs, their x-rays, any of their electronic files, and we're right here in the room with the patient, and we can go through that with them, so they're getting not just my impression, but they're actually seeing the raw data themselves, which is important, I think, for patients. So the whole connection between our PCN, working with the individual physician clinics, and working with the Sun systems and the EMR vendors has been a huge advantage. Prior to that, it was sort of a one-man show trying to get out there and battle the different fields. Mostly which physicians don't have that kind of experience with, talking about technology and talking about the different vendors, and so having the relationship between the PCN and having some IT experts helping us out in that sense has been a huge advantage.